Hello, I'm Rujipa Samarasekara, co-editor of the book Educate, Train and Transform, Toolkit on Medical and Health Professions Education. Now the big question is, why another book on medical and health professions education? Well, the reasons are that we thought we will develop a book that is contextually relevant, simple to understand, and easy to apply some of the best practices shared in the book. If you go through the book, you will see that each section starts with a case scenario. And these case scenarios are day-to-day challenges or issues faced by basic or clinician educators in trying to create that effective and safe learning environment for their learner. The book then goes on to develop into what, why, and how. Here, we try to bring in the pedagogical underpinnings with the best practices and then try to make it simple for the educators to understand why certain things are done in a certain way. What is the rationale and also the evidence behind that. So we do hope that this book will be useful and relevant to all of you. We have also developed an online book, the version of the same book, so that you can download it and read it at your leisure. We are very grateful to our collaborators and also to our authors of different sections and chapters for their hard work and persistence and also being with us during this very difficult and challenging time. And I do hope that this book will help you to create that safe and conducive learning environment for your students, residents, and also to your colleagues. Thank you very much.
Much of today's education for health professional students will be based on human interaction. We must therefore prepare them for future practice as well.
Congratulations to Dujipa, Matthew, all authors and the SENMED team on the launch of your latest book. This excellent handbook on medical and health professions education offers practical advice and solutions to real scenarios and common challenges faced by health educators today, serving as a guide to help teachers rethink and restructure the way they deliver educational content. Each chapter is penned by local and international experts, covering a comprehensive array of topics such as curriculum, organization and delivery, assessment, and learner support. There's also a section on leadership and management in health profession education. This will be of great interest and usefulness to forward-looking educators who seek to nurture future-ready healthcare professionals of the 21st century.
A very good morning to Professor Matthew Gwee, Chairman of the International and Education Programs in the Center for Medical Education, Dr. Dujipa Samarasekara, Director of the Center for Medical Education, Yongleden School of Medicine, and the Center for Development of Teaching and Learning, NUS. Colleagues, ladies and gentlemen. First, I would like to congratulate Dr. Dujipa and his team from our Center for Medical Education on the successful release of their book, Educate, Train and Transform, Toolkit on Medical and Health Professions Education. Developing and reforming medical education has always been a monumental task for medical schools. As medicine continues to advance and healthcare needs of populations evolve, the curricula of medical schools around the world face tremendous pressures to adapt quickly to meet these needs and expectations. As Singapore's pioneering medical school, we have the duty and responsibility to deliver a rigorous and forward-looking medical education as we continue to groom generations of aspiring healthcare practitioners, not only with strong clinical competencies and values, but also the potential to grow continuously as they practice their vocation. I commend Dr. Dujipa and his team for going above and beyond to analyze and understand how we can strengthen our education, pedagogy, and a commitment to keep exploring how we can make medical education more impactful and relevant for our students. It is no longer sufficient to train our students to know how to practice medicine. They also need to know how to come up with new and creative solutions to solve the multifaceted health challenges of the 21st century. This requires reassessing the way we teach as well as what we prioritize, and institutes of higher learning play a very crucial role in this regard. Finally, it is necessary for us as educators to realize that every teachable moment is fleeting. We need to seize and treasure every learning opportunity that may set off a spark in each individual, which can lead to a breakthrough in a personal or global capacity. I would like to extend my appreciation to the China Medical Board for their generosity in funding the publication of this book, and to all the contributors who have made this book possible. You make a difference that matters. Thank you.
Hello, everyone. It's my honor and privilege to be part of this virtual launch of Educate, Train and Transform Toolkit on Medical and Health Professions Education. I think that this short book is timely and will no doubt help to make sense of what can be a difficult topic. And I think the practical tips that are within this book will be very useful to anyone who is engaging in medical education. So congratulations to both of you, and well, I look forward to more collaborations and more success from the two of you. Take care and stay safe.
I wish to congratulate the editors, Dr. Dujipa Samarsekara and Professor Matthew Gwee, the NUS team led by Ms. Sume, and the World Scientific Publishing for this unique achievement during a very challenging time period. It's an honor and a privilege to be part of this landmark publication, Educate, Train and Transform, Toolkit on Medical and Health Professions Education. The section 1 is authored by myself and Dr. Dujipa Samarsekara. It focuses on the change process of medical education. Why, how, when of the change process in medical education. We also discuss the optimum available and affordable utilization of technology in the change process. Key message of this section are systematic and stepwise and strategic approach in change, and also, most importantly, winning the support and the trust of all the stakeholders.
Hi, I'm Tzu Xiong from the National University of Singapore, Yong Lu Lin School of Medicine. I'm one of the authors of the book. Have you ever wondered why learners just don't get it? Why are they not interested? Or why they're not able to apply? Have you been asking the question, is it because of what I teach? Or is it because of how I teach it? Or maybe you have asked the question, why is it that something worked elsewhere, or it has worked before, but it doesn't work now in your situation? Or perhaps because of the COVID-19 pandemic, have you asked the question, perhaps, how am I going to cope with all these disruptions? The answer lies with curriculum design. In this book, you will find the different instructional tools, strategies, and frameworks on how we can start with the end in mind.
Hello everyone, I'm Su Xing from the Center for Medical Education, Yong Lu Lin School of Medicine, National University of Singapore. So today we are going to talk about our book section and give you a brief introduction of what is this section about. With me, we have Wayne. Wayne, would you like to introduce yourself?
Yeah, hi, my name's Associate Professor Wayne Hazel. I'm working as an emergency physician at the Prince Charles Hospital, which is in Brisbane, Australia, and that's part of the Northside Clinical Unit for the University of Queensland. So I'm the site coordinator here. I've had a long-term interest in medical education in relation to the development of emergency medicine. and I've done a Master's of Medical Education or Clinical Education through Auckland University many years ago.
Thanks, Wayne. So Wayne is the main author, and I'm co-authoring with Wayne on this book section on delivery of instruction. Why don't the students get it? So in this book section 3, it is started off with a scenario whereby Professor Chase is a dedicated and passionate teacher for 20 years. He has been teaching and enjoying teaching as well. However, he couldn't understand why the students couldn't perform in the assessment, since he has dutifully taught the students all they need to know about the subject. So based on these scenarios, we came up with Chapter 1 on why, Chapter 2 on what, and Chapter 3 on how. I'm going to share with you a brief overview of what is in Chapter 1, which is the why. So in Chapter 1, we first explore who is our learner, and we followed by how our students learn based on the field teaching and learning theories. I'm not going to review the theories here. Hopefully you will read the book and you will learn more about the theories. And also, what are the factors that motivates them to learn? So in these factors, motivation factors, we talk about emotion as well as the affective component as well. So hope you will be able to get a sense of what is why, how to answer the why questions for this scenario. So as for Chapter 2 and Chapter 3, Professor Wayne will share with you what is inside this chapter.
Okay, so Chapter 2 is the what, and I guess the underlying premise for this is that medical education is a learned skill, and we can't always assume that we've had a positive learning outcome from our education endeavours unless we check. So this chapter goes into a number of whats, but it includes characteristics of effective teaching, the teaching environment, and teaching evaluation and peer review of teaching, to name a few. Chapter 3 is the how, and this goes into a number of features of outcome-based education, including constructive alignment, designing learning outcomes, but also looks at the teacher developing a toolkit, using working rules, clinical reasoning frameworks, and working on their ability for teaching dialogue and effective small group teaching. So I hope you enjoy reading chapters 2 and 3.
Hello, I am Gominda Punnappu, one of the co-authors of the section on assessment. Together with my co-author Lambert Schuworth, we have put together, I would say, a novel interpretation to basics of assessment. I would like to stress the word basics because it is nothing new, but of course with new insights. For example, in the introduction, we discuss the underlying basis of all our assessment best practices. We have termed these practices as features of a good test or good assessment. For the ease of understanding the reasons behind each of these features, we have drawn parallels between these features and something close to our hearts, that is clinical practice. In the first chapter, we explore the simple question why we assess. Here, we demystify two of the most often used terms in assessment, that is formative assessment and summative assessment. The second chapter on what to assess, there is an in-depth exploration of content validity and assessment blueprinting. Here again, we have tried to clarify some of the not so clear reasons behind the steps we take when developing an assessment blueprint. The third chapter is on how to assess. We have dedicated almost the entire chapter to workplace-based assessment. Here, we have tried to explain, rationalize, and suggest the best practices and the options available to the practitioner when planning, organizing, and conducting workplace-based assessment. By this time, you may have thought that this is a very theoretical section. If that crossed your mind, let me be clear that it is not so. All this will be done around a practical scenario given at the beginning of the section.
Hi there, my name's Marcus Henning. I'm an Associate Professor in the Centre for Medical and Health Sciences Education at the University of Auckland in New Zealand, along with Professor Tan Chae Hoon, who works in the National University of Singapore. We co-wrote this section around supporting learners, Why is my student so difficult to handle, within the book Educate, Train and Transform. And to tackle this very tricky question, we had 3 chapters and 3 case scenarios. Each case scenario was about a student who was experiencing some sort of difficulty with their learning. So chapter 1 was essentially around the why students might be perceived as being difficult. And of course, we need to think about not only the student, but also the educator and the wider university. So the things that we were looking at in chapter 1 was around their willingness to change, their level of academic and emotional preparation, what sort of strategies they were using, and what sort of style of learning that they were using, whether deep or surface. In chapter 2, we looked at some of the ideas that could be used to support students around mentoring, coaching, supervision, what sort of feedback systems we'd have in place, and of course the idea of academic and personal counselling along with learning contracts. Lastly, we looked at the university perspective in terms of regulations, their ethical and moral issues, and the idea of the psychological contract.
Hello everybody, we'd like to talk about our chapter that we've done for the new book, and it's all about leadership. I'm Judy McKim, I'm Emeritus Professor at Swansea University, and I work internationally with Paul and Kirsty on running leadership programmes. Paul?
My name is Paul Jones. I'm the Programme Director for the Graduate Entry Medical Programme in Swansea University. I also teach on the Masters in Leadership and have been teaching leadership and running leadership programmes with Professor McKim and Professor Forrest for many years. So welcome. Kirsty?
Hi, my name's Kirsty Forrest. I'm a Dean of Medicine here at Bond University in Australia. And as been mentioned, I work a lot with Judy and Paul on a lot of leadership courses, and I really enjoyed writing these chapters for GEPA.
There we are. So I think what we're going to do is just share our thoughts about, what we did for the chapter and what we enjoyed. And perhaps I'll just kick off. One of my thoughts really is to think about challenging some of the traditional ideas about leadership, these myths of leadership, that leadership is only for people at the top, that leadership and management and followership are different and so different that we can only manage or lead or follow. We do all of those things. And also I think that leadership is, people are born into leadership. No, we can learn to be better leaders and more effective. So they were some of the things I thought about. Kirsty?
When they wanted the why, the what, and the how parts of the what we were writing about, and therefore we based it on experiences that either we'd had or other people had had. So it's really, really practical, what we've written about. And I've even gone back to it after we've written it to reread and relearn again. So I think making it practical is going to be great for everybody.
Oh yeah, I totally agree. And Paul, what do you think?
I think one of the most useful things, and I think having taught leadership for quite a few years now, what students find and what trainees and consultants find is looking at that leadership in those 3 levels, is thinking about your own development as a person, so that's self, thinking about how you work in teams and how you develop yourself as a team member, but also thinking about the organisation you work with. And I think the model that we presented in the chapter was to very much the Swansea daffodil in terms of looking at those 3 levels of leadership. But we're now starting to think about moving on and considering the global implications of that.
Absolutely. So we did sow a few new ideas in there. We particularly looked at gender. Kirsty and I have a bit of a passion for that. And we put some stuff around challenging traditional ideas about who should lead and who's capable of leading and what you need to be a credible leader. So we hope that you enjoy it. We really enjoyed writing it, actually. So thank you very much. Thanks.
Thank you.
Thank you.
Hello, I'm Gary Rogers. I'm a Professor of Medical Education and Dean of the School of Medicine at Deakin University in Victoria, Australia.
My name is David Carr. I'm an Associate Professor in the Public Health and Sports Medicine Department at Missouri State University in the United States.
And we've written section 7 of the book, which is all about where we're heading in health professional education off into the future. And we've looked at a number of areas that we can see happening in healthcare and then health professional education at this point in time. And we've tried to look along the line of those developing ideas to what the changes we expect to see in practice, what new approaches we'll need to make that happen, and then what emerging methodologies will be required to make the changes we need in health professional education. The first thread that we've looked at is the increasing complexity in healthcare practice with chronicity and multiple disease, and also an increasing recognition of the determinants of health. And this leads to an increased need for interprofessional capabilities. But we've looked at some of the new ways and new developments that might occur in interprofessional education and what we've called second generation interprofessional education with the addition of new technologies and new methodologies. The second thread we've looked at is the increasing concern about practitioner distress and even practitioner suicide. And so we've looked at how we may be able to better help our students to build personal resilience, because all of the health professions are inherently stressful. And we've got some new ideas about how we might be able to build human capabilities and personal resilience into the future.
The third thread has to do with artificial intelligence and robotics. Increasingly, machines are able to do mundane tasks, but we see this challenge will lead to a reprioritization of our capabilities to focus on human capabilities, the affective domain. And this may lead to acquisition of new capabilities. The fourth thread, it has to deal with just-in-time information. Everybody has a device in their pocket that can recall information more accurately than the brain can. So now we have to start changing how we're going to assess our learners and move towards more higher level learning outcomes.
The last thread that we looked at is the increasing extent to which complex technologies like artificial intelligence and machine learning will become part of everyday patient and client care. We wanted to look at what that will mean for how we educate our students to understand what's going on under the bonnet, or at least the extent they need to understand that in these complex technologies, so that they can fulfill their professional responsibilities to their patients and clients as they practice into the future. And as you've seen, for each of these threads, we've looked at all three of Bloom's original domains of cognitive, psychomotor, trained skills, and especially the affective domain, the value formation, because we have a feeling that that's the domain that's likely to be neglected into the future.